Okay, what else can cause epigastric pain? Gastritis, inflammation of the stomach wall. Let me say here that we have kind of 3 grades of damage to the stomach wall. We can have the superficial gastric erosion, very, or even before superficial gastric erosion, we just have gastritis. What's gastritis? Inflammation, irritation leading to inflammation of the cells of the stomach wall, and then these cells can be injured, and we can have superficial gastric erosion from the use of NSAIDs. Early stages of peptic ulcer are just superficial gastric erosion, and when this erosion is no longer superficial, this now turns to a peptic ulcer, and this peptic ulcer can be very deep to the extent of being perforated. So gastritis, it is not an ulcer. It is not even an erosion. It's simply inflammation of the stomach wall. What can cause gastritis? H. pylori. Number 1 cause of gastritis is H. pylori. The presence of Helicobacter pylori, and this H. pylori is a bacteria. We need to treat it by 2 antibiotics. The most commonly used ones are clarithromycin and amoxicillin, combination of clarithromycin and amoxicillin. And we also give a proton pump inhibitor, as I said, to reduce the acid in the stomach and give some time for this inflammation to heal. Alcohol is one of the causes of gastritis also. And we have another unique cause of gastritis, what we call atrophic gastritis, that is associated with pernicious anemia. It's an autoimmune disease, and this type will not improve with H. pylori treatment because there is no H. pylori here, but there is autoimmune condition damaging the stomach cells. And here the treatment is you need to give vitamin B12 replacement, and the treatment with vitamin B12 cyanocobalamin in such condition should be parenteral, not oral. So up till now we talked about H. pylori in 2 settings. Peptic ulcer disease, H. pylori causes peptic ulcer disease, and gastritis. H. pylori treats and causes causes gastritis. And these are the only 2 indications where we need to treat the patient for H. pylori. Let me be very clear here. Don't treat Helicobacter pylori unless there is gastritis or there is an ulcer disease. So don't treat Helicobacter pylori unless there is gastritis or there is an ulcer disease. A patient with GERD, are you going to treat H. pylori? Please do not. Do not even test for it. But the patient tested positive for H. pylori and he has GERD. What should I do? You shouldn't have tested for H. pylori in the first place. There is no role for H. pylori in GERD. So don't treat Helicobacter pylori unless there is gastritis or there is an ulcer disease. How to diagnose gastritis? Endoscopy with biopsy. Again, you need to do endoscopy. You need to see yourself. And if you see gastritis, no further testing is needed. Serology for H. pylori. Serology, well, it's sensitive but not specific. And negative serology will exclude H. pylori, but positive serology will not be very specific. What is very specific for H. pylori is the breath test and the stool antigen testing, very specific for H. pylori. The urease breath test and stool antigen testing, very positive for H. pylori. And as I said, the treatment is going to be proton pump inhibitor and clarithromycin and amoxicillin for H. pylori. If the treatment fails, you can repeat with another antibiotic combination, metronidazole and doxycycline, and now we can even use levofloxacin, ciprofloxacin, chloroquinolones for the management of very resistant H. pylori infections. If the treatment fails still, we might be facing Zollinger-Ellison syndrome, too much acid, and this we diagnose it by high gastrin level and high acid level in the stomach. This is Zollinger-Ellison syndrome, and the most accurate test for Zollinger-Ellison is endoscopic ultrasound. Okay, let's do this question. A 57-year-old man presents with epigastric discomfort for 3 months. He tested positive serologically for H. pylori. Upper endoscopy did not reveal gastritis or peptic ulcer disease. Biopsy showed H. pylori. What to do? Biopsy showed H. pylori. What to do? Please do not choose to treat H. pylori, because remember, upper endoscopy did not reveal gastritis or peptic ulcer disease. What are the indications of treating H. pylori? Gastritis and peptic ulcer disease. Does this patient have one of them? No, this patient does not have any of them. So what's the treatment? Only symptomatic treatment by proton pump inhibitor. Remember again, don't treat Helicobacter pylori unless there is gastritis or there is an ulcer disease. A 59-year-old man presents with epigastric discomfort for 2 months. There is no weight loss and his stool is negative for blood. What to do next? What's the best next step? The best next step is what? Upper endoscopy. Why? Because this patient is 59-year-old patient, and we need to be sure that there is no gastric malignancy. Let me conclude this section with epigastric pain cause. The most frequent cause of epigastric pain is non-ulcer dyspepsia. And how to diagnose non-ulcer dyspepsia? Simply by excluding all other causes of chronic epigastric pain. So what test to be done in non-ulcer dyspepsia? All tests are to be done. What is a positive test for non-ulcer dyspepsia? There is nothing. All tests should be done and all tests should be negative, and this is when we come to the diagnosis of non-ulcer dyspepsia. And how are you going to treat? Symptomatically. Give antacids, give histamine 2 blockers, or give proton pump inhibitors.